The world is inching closer and closer to a final cure to the dreaded COVID-19 disease caused by the coronavirus, as a common drug, dexamethasone, has come out with outstanding results after preliminary findings of the recovery trial. Starting March 2020, this trial has involved more than 11,500 COVID-19 patients so far. Nuffield Department of Public Health and the University of Oxford, led by Professor Peter Hobby, are the brains behind this philanthropic work to humanity. Samuel Mickey presents why dexamethasone is so powerful. And if you stay to the end of this video, there is a bonus info about side effects and how to adjust to it. Please stick to the end of this video in order to find out the side effects and how to adjust to it. Number 1. Rheumatoid arthritis. For patients with a prolonged history of rheumatoid arthritis, doctors use what's called pulse therapy, which usually includes dexamethasone with high dose of glucocorticoid called steroids. By the way, pulse therapy or pulse dosing is a treatment regimen that produces increasing antibiotic levels early in the dosing interval, followed by a prolonged dose-free period. In this method, antibiotic is usually administered by means of 4 sequential bolus injections, after which the antibiotics levels are allowed to deplete completely until the next dose. One point to note is that steroids are both anti-inflammatory and immunosuppressive, which implies that they reduce the workings of your immunity, which is why they are often used for fast, temporary relief while waiting for disease-modifying anti-rheumatic drugs or biologics to take full effect or during a severe episode of arthritis symptoms. Hope you're not feeling doubted by the slings of medical grammar bombarding your head right now. If you're not, kindly hold on to the end of this video. Meanwhile, you can like, share and subscribe to this channel in order to get more informative videos like this. Number 2. Croup is an infectious disease caused by several viruses, with parainfluenza virus type 1 to 3 as the most common. It is common for about 15% of emergency visits, due to respiratory diseases in children in the United States alone. It usually presents mild symptoms and children get well without needing any treatment. Sometimes, however, a child has difficulty in breathing. That's where dexamethasone comes in, as it reduces inflammation and helps to breathe more easily. The best part is that you don't really need much dosage. A single dose is all that's needed to ease the breathing, although some children may need more than one dose. Procedure: tablet should be swallowed with a glass of water, milk or juice. Please note that children should not chew the tablet. Crushing and mixing the tablet with a small amount of soft food such as yogurt, honey and jam is perfectly fine. However, do ensure that your child swallows it straight away without chewing. If it's the liquid type, measure out the right amount using the medicine spoon or oral syringe, because using a kitchen teaspoon may not give the right amount. It's essential to keep your child calm within the first 1 to 4 hours, as the drug restores your child's breathing. A bit of entertainment such as playing music, reading stories, or watching television or cartoon would also be of immense benefit. Number 3. Treating eye issues. Swelling, redness and inflammation of the eyes are some of the issues that dexamethasone can resolve. However, it's important to note that wearing of contact lenses while using dexamethasone is a bad idea, unless instructed by your physician. Besides, always use sterilized contact lenses according to the manufacturer's directions. If you must use contact lenses, ensure that you first and foremost remove the lenses before applying the eye drops, in order to avoid the preservatives in the eye drops from being absorbed by the contact lenses. Wait at least 15 minutes after each dose of the eye drops before applying the lens again. It is also advisable to use the drops every 30 to 60 minutes until your symptoms are controlled, and then 4 to 6 times a day for a few days. It is not uncommon for eye drops to cause blurred vision when first put in, so don't be scared. Still, do not drive or use tools or machines until your vision becomes clear again. Number 4. Anti-cancer. Since dexamethasone has been known for reducing inflammation and suppressing the body's immune response from overfiring, It's been especially effective against these types of cancer: leukemia, lymphoma, and multiple myeloma. It reduces swelling, also known as edema, usually present with tumors of the spine and brain. If you are feeling nauseous or vomiting after taking some chemotherapy drugs, dexamethasone will do a good job for you. It also stimulates appetite in cancer patients. Number 5. It treats high altitude sickness. Remember climbing that staircase up to the 15th floor of a skyscraper? The higher you go, the more you feel like your body is empty of nutrients or something else. That feeling is called high altitude sickness. Sudden ascent to a high altitude can cause high altitude sickness. Physical distress from adjusting to lower oxygen pressure at high altitude is its hallmark symptom. The 3 kinds of high altitude sickness are acute mountain sickness, AMS. This is the mildest form and is very common. The symptoms usually feel like a hangover: dizziness, headache, muscle ache, nausea. High altitude pulmonary edema, HAPE. This is a buildup of fluid in the lungs. This can be very dangerous and even life-threatening, so take note. High altitude cerebral edema. This is the most severe form of altitude sickness and happens when there is fluid in the brain. That is a life-threatening situation and requires an urgent medical attention. Dexamethasone can treat all these sicknesses and is often used as prophylaxis, that is, preventive medicine for those susceptible to high altitude. Number 6. Alleviates sore throat. One ailment that dexamethasone will be potent to resolve within 2 days of use is sore throat. There is a study published in the Journal of the American Medical Association which discovered that a single dose of oral dexamethasone alone may be sufficient to resolve symptoms 2 days after presentation. About 6,000 UK adults experiencing acute sore throat and were clinically assessed not to be in imminent need of antibiotics were randomized to 1 10 mg dosage of oral dexamethasone or placebo. Clinicians offered at their discretion no antibiotic prescription or a delayed prescription. However, if those symptoms persisted after 48 hours, the patients were allowed to use antibiotics. What was the outcome? There was no change in complete resolution at 24 hours between those administered dexamethasone and placebo groups. However, 48 hours later, things started taking shape. There was 35% complete resolution for the group using dexamethasone versus 27% for the placebo group. From this experiment, it's not too much of a wide guess to conclude that dexamethasone has promising potential against sore throat. What do you think? Number 7. Treatment of COVID-19 patients. Dexamethasone is extremely beneficial for COVID-19 patients who are on ventilators or oxygen, while not affecting those with mild coronavirus symptoms. It reduces the death of patients with severe respiratory conditions by up to 30%. It is so effective that the United Kingdom, a country so hard hit by the COVID-19 pandemic, has approved it for use for critically ill patients in order to reduce their mortality rates. We can only imagine more countries following suit because at the moment, even doctors who use it as an off-label medication are seeing remarkable improvement on patient recovery. One thing to note is that the medical effects of dexamethasone are frequently seen within a day and last for about 3 days. Bioavailability is 80 to 90%, which is quite a good number. Bonus tips. Side effects of dexamethasone. The following side effects are common, occurring in greater than 30% for patients taking dexamethasone. Increased appetite, irritability, difficulty breathing, otherwise known as insomnia, swelling in the ankles and feet, otherwise known as fluid retention, heartburn, muscle weakness, impaired wound healing, increased blood sugar levels. It's important to note that people with diabetes may need to have blood sugar levels monitored more closely and possible adjustments to diabetes medications. How to adjust to dexamethasone. Eating foods high in insoluble fiber, healthy fats and vitamin C are of immense benefit in alleviating most of these symptoms mentioned while taking dexamethasone. Foods like yam, beans, sweet potato and banana are excellently rich in soluble and insoluble fiber, which gives a long-lasting reservoir of energy throughout the day. Besides, they help in flushing out toxins and metabolic waste from the body. Drink enough water during the day, especially if you walk around a lot or engage in mental tasks. Water is also great for relieving heartburn. However, seek emergency help or notify your healthcare professional if you notice any of the following symptoms: fever of 104 degrees Fahrenheit or 37 degrees centigrade, chills, which is a possible sign of infection, irregular or fast heartbeat, shortness of breath or chest or jaw pain, sudden confusion. Have you used dexamethasone for any illness before? Did you experience any side effects? Did you know of any other drug that is as promising against COVID-19? Let us know in the comment section below. I'll see you in the next video.